Oh, welcome to our live stream, How to Stay Healthy During COVID-19 with our esteemed Dr. Haddad. How are you?
I'm doing wonderful. Thank you. Thank you for having me on. How are you?
Very good, and really happy to have you here and taking the time out to help us learn and help us share a little bit and learn a little bit more about prevention and protection. And COVID-19 has been really a long journey for many of us. So thank you so much for taking that time out
Oh,
of
you're
your
welcome.
day. So I'm going to encourage folks to go into the comments section and share with us where you're tuning in from. What city you're calling from? Where are you watching from? What are you doing? Learn and to get into some of the content of this discussion. And as we wait for a few more folks to be joining us live here, we are on Facebook, we are on Twitter, and we are on YouTube. So this is really great. I want to remind folks that we do have a COVID-19 website as a reference, which is smchealth.org/coronavirus. And we'll be sharing resources throughout this live stream so that you can have access to all the local resources that you may need during this pandemic. So, Dr. Haddad, you live in San Mateo County?
I do. I was born here and bred here. I've lived in Burlingame, San Mateo for most of my life, and really just honored to work for the county. So it's been a great pleasure and just loving working here. But yes, I live in Redwood City now, lived in San Mateo, Burlingame. So I've had my share of San Mateo County for my life.
Wow. So did you do your residency locally as well, or somewhere else?
I did my residency in San Francisco, so our local County, north of us at CPMC. So that's where but I did go to medical school in Texas. I was able to see a different part of our country at that point as well. But I have most of my life I've lived in the Bay Area.
That's great. I live in Alameda County and myself, but work in San Mateo, and so it is great to see the San Mateo County Health really coming together and supporting all the residents there. And I'm really proud to be part of that team as well. So I just want to welcome folks as they come on and join us. For those just joining us, we're here with the esteemed Dr. Haddad and discussing COVID-19 and how to stay healthy during it. We're going to talk about face coverings. We're going to talk about prevention. We're going to talk about some tips on how to stay healthy. So please share this if you can. Write in the comments where you're calling from, and let's get this started. So tell us a little bit about your background. How did you get interested in medicine, and kind of what brought you there? I know you mentioned you went to school in Texas as well, but tell us a little bit about that journey.
So I'm very fortunate. I feel like medicine and being a physician has been kind of part of who I am since I was in second grade. So in second grade, during that time, they asked, "What do you want to be?" And I drew a picture of being a doctor. And since then, truly feel very blessed that I get to do this every single day. So that's kind of always been my goal. And so I went down to UCLA for my undergrad, and then went to Texas and lived there for 7 years, and really loved experiencing that part of the country as well. And then I married my high school sweetheart, so he also is a Bay Area folk. And so at that point we said, well, now that we're going to start planting our roots, the Bay Area is really where we wanted to come back. And so fortunate enough to come back to CPMC, do my fellowship there. And my first and only job that I wanted was to work for the county. And so luckily applied here, and with lots of support from my residency, was able to get a position here back in 2007, and have not looked twice at anything else since then. I'm a primary care physician. That's what I do most of the time. So adults, patients are what I see for your chronic diseases or acute diseases, and so that's usually my hat that I wear, and I'm most proud of. I've had many opportunities to wear different hats throughout my career, but that's the hat that's been the most consistent. And so I've worked at different clinics within the county, but it's always been in the county, serving our population, which is really close to my heart and my mission of what I would like to do.
Wow, we are really lucky to have you, and really lucky to have you today. Again, it's just a reminder that we're talking about how to stay healthy during COVID-19. This is a live stream with Dr. Haddad, and we're just getting started here and just talking a little bit about Dr. Haddad's experience. So did you come from a medical family? Is that, I mean, a second grader seems like
no, yes. It's interesting because I reflect, and I think I probably, we grew up and didn't have a primary care doctor, and my parents owned a deli, so insurance was just something that was not part of our makeup. And so I think I remember a physician who I can't remember her name or anything like that, and one of how to do a physical for school, and remember thinking, oh wow, this is something that's interesting. And we had just recently come from Jordan in the Middle East, where we lived there for a couple of years, and so that question really of what you want to do, and having that experience just recently just kind of made it feel like it was the right place. And I've been really fortunate that every decision just made it seem like the more of the career path that I was going to take. And so no physicians in my family, and in my immediate family, but just love this career, and just love being able to serve our population and our patients.
Well, no doctors yet in your family. You have ones, right?
I do have 2 little boys. I'm not quite, we'll see where they decide. They haven't drawn the picture. They're both past second grade, and they haven't drawn the picture of what they want to be yet. So we'll see. They have, whatever possibilities. As long as it makes them as happy as it makes me, then that's okay.
That's great. Well, again, we are so lucky to have you here. So I'm really excited to get into talking a little bit about the healthy side and staying healthy during COVID-19. Just to start us off, I'm very familiar with San Mateo's Medical Center and how it maps to San Mateo County. It's a division, and it's a large division of the health system that's in San Mateo County. And so I just wanted to talk a little bit about your daily work and how that's changed, and maybe the SMMC role, the San Mateo Medical Center role during COVID-19. What's the response been? And then maybe I have a couple of questions off of that might help folks navigate how to seek care during this time.
Oh, great. Yeah, so San Mateo Medical Center is our county health system, and we have 11 satellite clinics that really does from our pediatricians to our senior care patients all the way north from Daly City south to Redwood City. And then we also have a clinic in Coastside as well. And so we have our satellite clinics that does primary care and specialty services like musculoskeletal, podiatry, our endocrinologists. So if you have diabetes, can see them in our satellite clinics as well. And then our main hospital and our emergency room is located in San Mateo with other clinics as well here. So we're located for the convenience of the whole county to try to really establish care where they're close to home. Because our county is wide and has some subcultures in all of their locations, I think all our satellite clinics also take that culture as well and take the personality of where they are, and they're all unique and amazing in their own separate ways. That's kind of where we're located. I have, again, in this time of the pandemic, the honor of working here has just rose again. We knew that because our patients are vast around the county, that as soon as COVID hit, that our patients would also be affected. So really late in February, we became quickly ready to serve that population through our emergency room, all the way from our custodial to our front staff to our medical assistants, our RNs, our providers, came together very quickly in the end of February, which seems like many, many months ago, years ago at times, but came together and said, okay, we really need to be ready to keep our staff really safe and be ready to really for whatever our patients came. Back when March started, we didn't know how many people were going to come through our doors. We didn't know exactly what we know today as we continue to learn. So we all came together and just really were available for our patients. And I'm just, again, really proud of how many patients we've served through this time that have COVID, and also patients who haven't had COVID through this time. It really took a really great team effort from all of our staff.
It really is a team effort, and that's absolutely the case all around healthcare. And you are our heroes, really. And you are the people that are on the front line and seeing this and responding firsthand. So huge thank you to you and all of your team and all of San Mateo Medical Center. It's really amazing how people have stepped up in so many different ways, both small and large. A question I know that we sometimes get is it safe at this point to seek health care, medical, or go to medical appointments for patients during COVID-19? At this point, there's probably concerns of residents. Should I go and have this seen? Should I go and see my doctor, or is it safer for me to just stay at home? Is that something that you might be able to speak to?
Yeah, definitely. I think with COVID, and we shut down really quickly. And so the reopenings, and kind of that's the phase that we're in, we are realizing that there's fear among all of us of what does that really mean. I do want to say that I do think clinics and hospitals and emergency rooms, because we needed to be really ready and had lots of experience of patients that needed to come in with COVID, I do feel that it's very safe. Ironically, a couple of weeks ago, my son, who is starting in 6th grade, needed to get some vaccines. And I'm like, okay, we're going to go. And, this is what I live every day. And I realized he was concerned. And so we had that conversation, and again, everybody's going to be masked. There are going to be less people in the waiting room. Clinics everywhere are taking this very seriously. And so it is a really safe place as long as we take the correct precautions. The other big shift that we've done in our ambulatory services, so ambulatory is when you see patients in your normal doctor settings, not in the hospital or surgery, is that a lot of our visits can be done through the phone or through the video. And it's so shifting also how doctors and providers and nurse practitioners are really seeing our patients, but that really adds another layer of safety where you could get a lot of information through that way of visit. And then if you do need to do a physical exam, the amount of time together or in a room is lessened. And so, I do call your doctors if you have any concerns, call your providers and your primary care physicians and staff, because it really is important to make sure all your chronic diseases are taken care of. The one thing that we do know about this disease is that if you do have chronic diseases, having those controlled really does help just your physical health and improvement and just staying healthy if you do get exposed to this virus. So I do know that all of us in ambulatory are here to really serve you and be ready and just, I think, be open to a different way of seeing a doctor or a nurse practitioner. It might be a phone, and it might feel a little bit uneasy or different the first time, but I assure you, you'll get great care that way. So reach out to your primary care doctor.
So I know that I have done video appointments and have, while they were odd for the first 5 minutes, it seemed quite normal thereafter. And so I share the experience that it actually worked out really well for me. And I encourage folks, if there are video appointments that they can do, that's a great way to supplement your medical care when possible. And I had a great experience with it. So, and I know that we're ramping up at San Mateo Medical Center for that as well.
Yeah.
Let me ask you a little bit about the basics. So COVID-19, how's it work? What do we know this moment? What have we learned over the past couple of months?
Yeah, I think so. I think the one thing that is really important is this is a new virus. And so it may feel like information's changing all the time, but I think the real purpose is that we're just learning more. And so in the beginning, the information that we had was very broad and very non-specific. And as we've learned more, it's become more specific and more related to the virus. So the virus lives in your saliva. So it really could only enter through your eyes, your nose, and your mouth. And so really that's what you need to protect yourself from to get, and that's the way it spreads. So when you're speaking, you release a little bit of saliva in the air. When you sing or talk or all of that, it comes up in the air. And that respiratory droplet is what we call it. If it enters through your nose, mouth, or eyes, that is how you could get infected. What we're learning is it does take a certain amount of virus to actually get infected. How much that is, we're still learning, but so all of that is important. So, that is why the masks is really a key aspect of what we learned. Initially, we weren't sure how protective it was going to be, how big the droplets needed to be, but we really have learned that masks not only protect you from spreading the disease, which we've always known, but it actually helps you from getting the disease as well. And so I think that is why the shift in the last month or so has been really to wear a protective covering over your nose and mouth. And it really has shifted from not only does it protect everyone around you, it also protects yourself. And so I think that is the key thing that we've learned about this virus. The other thing that is different about this virus is it doesn't just affect your respiratory, so not just like your lungs or your sinuses. We're learning that it may affect other parts of your body, and it comes out in different ways, and you may have symptoms that are different. So I always think if you are concerned or have any questions, this is where I encourage you to call your providers and ask them and just say, this is what I'm feeling. Is this kind of consistent with COVID? We know shortness of breath, coughing, fever are the most common things that our patients are having, but there are other symptoms that can come with COVID. And so fatigue or loss of taste or sore throat, which is a less specific symptoms that you may have. And so it's kind of putting the whole picture together and just, really understanding how you're feeling and then what your normal is. So someone who has a chronic cough and has a cough doesn't mean that they have COVID. But again, it's really knowing where you currently are and the changes you may feel.
And then how about those without any symptoms at all?
Yeah, so that's, I think that's the thing that's really tricky about it. And we don't know if it's 20% of the population to 40%. We don't know how many people walk around with no symptoms at all that may be casually spreading it. And so that's why it is so important right now to really make sure that everybody has masks, because it is common that someone who has no symptoms whatsoever is actually carrying the disease. And unfortunately, if they go out in the public, they may spread it. Or if they are not protected, they may get the disease and come and spread it in their family. And so that is why, the facial covering is really the most important thing you can do to stay healthy and keep your family healthy. Because yes, the majority of people may not have symptoms, or if they do, they have mild symptoms, but we don't still know who is going to have severe or moderate symptoms. Until we really understand that completely, we know who's higher risk. Everybody really wants to protect their loved ones and really protect themselves as well.
Great. We have a question from Shane, and the question is about transmission on surfaces. It was initially thought that it was very easy to transmit, and now that has changed. Is that something that's still being researched? Is there something known about that?
Yeah, so it's true. Again, in the beginning, we did a really broad net saying, it could be transmitted in many different ways until we really understand. So it is true that the virus doesn't live on surfaces as long as we had first thought, or the amounts of that they may live is not as much as we thought initially. But hand washing, because we all touch our face and nose, if you sit there and within an hour, everybody touches their face and mouth accidentally or on purpose. Washing your hands is still really recommended. Using the alcohol sanitizers that are around is still very important, because again, you don't know if someone, and now again, because more people are wearing facial masks and it is required in a lot of the areas, if they do sneeze or cough, it's going to be more contained, and so the amount of virus that might be in a surface is going to be less. But again, it is important to always wash your hands, carry the sanitizer. I have one in my car. My husband has one in his car. As soon as we come back in, we sanitize our hands, make sure it dries. Sometimes it takes 10 seconds to dry, sometimes it takes 30 seconds to dry, and then we remove our mask. So again, it's really important to keep our hands clean, because that is a very common thing. And again, I have 2 little boys who, as much as I want them to keep their hands away from, and one has braces, so his fingers always like messing with that braces, like keep your fingers out of your mouth.
So you brought up the notion of, so I have hand sanitizer here.
Perfect.
How much hand sanitizer am I putting? 1 squirt?
Yeah, so each one has a little different thing, but again, so for that, it probably says on there, but you really want your whole hand to have the alcohol on it, and you want at least 60% or more of the alcohol content for the hand sanitizers to really kill the virus. And so for that, it's probably 2 squirts in each hand. Really rub them together really well. Make sure that they're dry, because that's, as soon as everything has kind of a drying time to say that's the most potent it is. So let it dry completely, and then you're able to use your hands. It's just kind of like, and then hand washing is still really important, but of course, we can't have a sink and soap everywhere, but so that is not quite as easy to get to.
Is there a preference between one or the other?
So they both work well. The one difference is if you have dirt in your hand, soap and water is going to work better, right? And so because if you have something that's visibly dirty, then you do need to remove it with a soap and water. If you have nothing dirty, then you're just removing the germs. And so either one work equally well, as long as it's got at least 60% alcohol in the sanitizer.
Okay, I just checked. Mine's 62%, so
Yay.
I'm good. Can I ask, so COVID-19, we've gone over the basics and how it spreads. Are there any like real big misunderstandings that that you've figured out? I mean, you kind of already acknowledged a few, but if there are any other misunderstandings, that's like the number one thing that a patient comes in, a client, and says, hey, does COVID, and is there, something there that you want to share that just is not true?
Yeah, I think the biggest misunderstanding is that, I would know if someone is sick, and so I know who to be safe around. And I think because there are many in our population that will not have symptoms, that's just not, that is really where it becomes unsafe. So, it's really hard to treat everyone as possibly having the disease because it limits our interaction, and we have to kind of change our social interaction with our family and friends. But truthfully, we don't know who is positive at a time that they're positive. And even so, that I think is the biggest reality, is that there are going to be people in our community who don't have any symptoms at all and can still spread the disease for up to 10 days or 14 days and not even know it. And so just to make sure that, wearing a mask, as simple as that may seem and as complicated, and I know there's a lot of questions regarding masks, that really does protect everybody around you in case you are someone who's asymptomatic. No one wants to be that asymptomatic person who gives it to a loved one on accident. And so wearing those masks when you're out in public, when you're going shopping, also is really important. I think that is the one thing that we've learned, and that masks really protect yourself as well. I think that is the other big thing that we've learned in the last couple of months. Initially, masks really was there to protect other people in case you were ill, but we're learning more with this disease that also protects you from getting it as well.
That makes perfect sense. For those just joining us, we're here with the esteemed Dr. Haddad, and we're discussing COVID-19 and being healthy during COVID-19. We're going to be discussing face coverings and more about COVID-19 prevention. If you are tuning in, do let us know in the comments section where you're tuning in from. Tell us a little bit about yourself, and also ask questions if you have specific questions. We will be getting into face covering soon, but until we, just before that, I just want to talk a little bit about activities that are high risk versus activities that are low risk, and just try to give us some guidance on what can we do, what can we really do. And this isn't a legal question. This is what can we do and still be healthy. So if you can tell us, some of the typical activities that residents might want to do, and those that are lower risk and those that are higher risk.
Yes. So again, because we live in the Bay Area, it's easier for us to say, other than this week with our heat wave, to say, be outside. So the safest place is outside 6 feet away from the next person. That is the safest way. And so we, in our family, decided we were going to learn how to play golf. My husband played golf before, but the rest of us did not. And I can't say we've learned it, but we've tried many, many weekends. So outside, with your family members that live together, of course, is the safest. But that way we would sometimes bump into friends that were a couple holes in front of us. And so we would just wave and say hello. So again, outside is the safest thing possible, 6 feet away from everybody that is not who lives in your house. Inside, and this is where the face coverings becomes even more important, inside in a non-circulating room, or that it's dark and it doesn't really have a lot of wind that goes through the room, that's going to be the least safest. And so if you do need to go in there, that is where it's really important to make sure that you have the correct mask, the safest mask, the least amount of time that you're there, and really have a purpose to be there, right? And so that's why some of the areas that are like that is just not as safe, because we're still trying to understand how long, if someone was positive and they leave, how long can someone else get it? We don't think it's that. We're still learning a little bit more, but I think we do know that that's the least safest place. So if someone before you was positive, didn't have a mask on, and then all of a sudden you walked in without a mask, that is going to be the most dangerous aspect, other than being in the same room at the same time. And so again, that's why as you wear your masks, the bigger the room, the more airflow, the safer it is for everybody involved.
And of course, I'm going to state the obvious. If you're alone, it's safe no matter where you are, right?
Yes.
But so groups and groups, obviously, there's different groups. There's groups that's your immediate family, but then there's groups, your next door neighbor or your extended relatives. And activities, how about activities outside? Are the same rules true for indoor, outdoor, 6 foot and mask wearing for those extended groups?
They are, and this is where it gets really difficult. I'm very fortunate. Both my brother and brother-in-law live locally, and my parents. So we all are, and normally we see each other once a month. Both my brother and my brother-in-law both are in the field, so in the plumbing world and the electrical world, and so they're exposed to a lot of other people as well, even though they're wearing masks. And really proud of the work that they're doing in their fields to keep making sure all the guys are safe and all the people are safe that are doing the work for the construction world. But because of that, because it's not, unless you're by yourself 100% of the time, that's the only way 100% you're not going to get exposed. We haven't seen them. My dad turned 70 a couple of weeks ago, and the plan was to have, it's a big moment, and my parents just celebrated differently with me and my brother, and so it is, even though it is my brother, he doesn't live in my house, and he has his own circle, and I have my own circle because I do come to work, and so limiting the people that I expose my family to, and he limits the people he exposes his family. Both of us exposing our families would just double the exposure. And so we've decided at this point, okay, as hard as it is, we'll do the Zoom calls and we'll celebrate in that way. And we have kind of a little bit said, should we do a barbecue outside, where everybody has their plate put together, and you don't share utensils, you don't share food, because as you can imagine, chips, everyone dipping in the same dip is not the ideal thing. We haven't done that yet, but we're almost there, because I do think we haven't seen each other in a long time, and it does get hard. But again, we want to limit the exposure to our parents and making sure they stay safe. And so those are the decisions we've been making right now.
It's a different decision for each family.
Correct.
It's a very personal decision. We do have a question from Mel, which is a really great question. Are pools and lakes safe at this time if they're staying 6 feet away from others? Can you transmit, the virus via water, via pool?
Yeah, that's a great question. So right now we think they are very safe. And so as long as you're 6 feet away, there has not been any cases of transmission that way. The chlorine or the water itself seems to keep the virus and not infect other people. So I do know that there's a couple places that we participated as a family where 3 families shared a pool that's a public, not quite a public pool in our house, and we just stayed in our corners, and it was, again, different kind of summer this summer, but that is safe as long as you're 6 feet away from any other family member and everyone's respecting those rules. And then once you're outside of the pool, masks on as you're sitting in the area, in the lounge area.
So let's say you go to the pool or you go to the lake and you either know of exposure or you've bumped into someone. When actually should one get tested for COVID-19?
Yeah, that's a great question. So I think the one thing, I wish we could say that medicine is a perfect science. We're always learning. And so the one thing about testing is it's just a period of a moment. And even our test, if it is positive, you're pretty sure that you have it, and not even 100. Some people still could test positive and no longer are actively sick or can transmit the disease. But if you're negative, it just adds one information. It doesn't say you're 100% you don't have the virus. Our testing is really great at saying, yes, this person has it. But so really the testing is just one more data point. So it's really how you're feeling, if you've been exposed. So a negative test to someone who has been sitting at home all day for the last 6 months, it's probably a negative test. But someone who has a negative test and their husband has a fever and they tested positive, we might actually just say, yes, the test is negative, but you should actually stay home. You should make sure that you stay safe, and you may need to quarantine and just make sure we don't expose you to other people, because the test is not 100% accurate when it's negative. So that's really a difficult concept, and it sometimes makes us feel like, oh, it's negative, that means I'm safe. But it doesn't. It really depends on what your risk is. And so that's why have a real conversation with your provider to really understand what that negative test means at that moment, right? Because the test could be negative today, and then tomorrow I could get exposed, and that negative test yesterday is no longer valid. So that's the only thing about testing. It doesn't tell us what we're going to, if we have the virus after the moment, that second that we get the test done.
Right. You could literally get it on the way out. Right.
You can.
For those just joining us, we're here with the esteemed Dr. Haddad discussing all things COVID-19, including face coverings and preventions, how to stay healthy during COVID-19. So please, in your comments, you can ask questions. Tell us where you're coming from, where you're tuning in from. We would love to hear those. And so let's just ask a really quick question about considerations for children and how to keep children safe. Are there different rules for children?
So, so children do get COVID as well. We have young babies to 18-year-olds, and they do get it. And the disease sometimes is the same way as adults, and sometimes it comes up a little bit different. Because we did home learning at the end of the school year, we don't know exactly how easily it is spreadable from kids to kids as much, but they are spreaders, and they do catch it. Just we don't know exactly compared to adults. So I think that is the number one thing that we're learning now. There is an age cutoff around 11 years old or so of how a child or an older child may have the symptoms, but we still are learning from that part. So wearing masks, it's the same rules as for children. Wearing masks, staying 6 feet apart, which is really difficult for kids. Again, I have 2 boys, and physically active is kind of how they're made, right? My mom always looks at me and says, they're boys, they're going to be on top of each other. And so that is the truth. And so I think really learning how to respect that, and just setting your kids up for success, because and talking to them, and they all are going to understand. Even every family decides to share things with their kids differently, but no one now doesn't know anything about COVID. It's out there, and people have opinions. And so really sitting down and talking to your kids and just saying what they know, what they're scared of, is and what they want to do. And so your kids may say, I don't want to wear a mask because I'm really scared. And so talking to them of why they're scared and understanding that is really going to be important, because every parent wants to protect their child just as much as anything else. And so really understanding what the fear is or what their concerns are, and just kind of talking through with their pediatrician, and having their pediatrician has had that conversation many times, and it's different for each age. So kids under 2, we do worry about masks because they're still little and suffocation can occur. So we don't recommend kids under 2 to wear masks, but 2 and over, they can learn, and every kid is different. And it does protect them, and it protects everybody around them. And so, it's just a different conversation with your children, though, and just knowing where they are and understanding what their risks are as well.
That is great insight, and I really appreciate that. There are so many who, while we worry about ourselves, it is our children that really drives our nightmares crazy and wild. And so knowing how to protect them is really important. And so just to recap, you said, frequent hand washing, social distancing, and wearing a mask if you're over 2. And so those are the 3 basics that are out there. And I think that's great advice for all those who are caretakers of young children. So I know we have a lot of questions about face covering. So I want to just put up first kind of a slide that talks about face coverings and the many different forms and styles that they come in, from the fabric mask to the fitted mask to a scarf to a gaiter, and the filter and dust mask. And so I have a couple of samples here and just wanted to kind of go through and talk about each one of them, and maybe have you guide me through the proper fitting for one or the other, and what you recommend and the pros and cons of each.
Perfect.
All right, great. And then we do have a couple of questions on masks as well, which we will get answered. So let's start with the 2-layer cotton mask, which I'm going to put on right here for you. And
Perfect.
so I have my mermaid, I don't know, fish print one. So I have glasses. So I'm putting it on over the ears, and these are just stretchy, ear binders. I don't know, binders isn't the right, stretchy material that goes over my ears.
Perfect. Yes, so that's a perfect fitting mask. So it's covering your nose, and it looks like it's really fitted over your nose, and it's covering underneath your mouth. And so that's really the key thing. And then if you make big movements with your mouth, the sides shouldn't really open up. So that's really very protective, and it looks like it's a 2-layer, which we do know is a lot more protective. And so again, for the grocery shopping, where hopefully everybody is wearing their masks inside, the amount of virus that's going to be in the air is going to be minimal. That's a great protection for most everybody. And so that is the right environment, outside, inside, that is really highly recommended.
And with this, it actually has inside, which I'll show those watching. It has a little pocket here. I know I shouldn't be touching the inside of it. I'm going to.
You'll wash it. You'll wash it.
I will wash this. But it does have a slot for a PM 2.5 filter. Is that an added layer of protection, or is that not needed?
It is an added layer of protection. And so, if you are going to be in a large group setting for something, even though you're 6 feet apart, and that is an added layer of protection. And so, yes, that does not add any harm. That's another way that you could do that. And then you'll take it out. Again, the key thing is, you're right, the inside of your mask should always stay clean. That is the area that you should protect the most. And so you kind of want to keep that as clean as possible, washing it, so rotating every day. You could have a mask a day, especially of our patients and our people who have to go to work outside of their home every day, to try to have one every day and just throw it in the wash and wash it, and then have the next one clean, because you really want to keep that inside clean. And that's why I said, before you put it on, your hands should be clean. You put on the mask the way you did, and then before you remove the mask, you should also clean your hands as well, because you really want to limit any kind of negative exposure to that, any dirty exposure.
And a question from Mel, which is 2-ply. We talk about 2-ply versus 3-ply. When is 2-ply okay enough, or is 3-ply better? How thick should each mask be?
Yeah, so the 2-ply seems to be a safe amount right now, from what we know at this point. And so 2-ply is safe enough, as long as it's kind of a cotton material, and you could put it on. If you add more plies, it just thickens the mask, and some people find it more uncomfortable in the breathing and the fogging up of the glasses. And so it is a balance of making sure, because the more you keep adjusting the mask, the less safe it is. So you want to make sure that you're not fiddling with your mask. And so when we talk about kids practicing at home for half an hour, just, let's try it for half an hour, because you want to take, you're going to take them to Safeway with you because you can't leave them at home. At least they practice a little bit for half an hour and learning not to touch it and keeping it on, because you will get used to it. And so the third ply may just add a little bit more uncomfortableness, or on these hot days maybe make it a little bit more, feel like it's just harder to get airflow. And so the 2-ply is plenty enough.
Okay. I did see on Facebook recently a parent who is asking their children who are resistant to wearing masks, they're only giving them screen time when they wear masks.
Oh.
So now their kids are so used to wearing the mask that it's not even an issue. But I get, it's something new and it's something different and it's something to adjust. So that is a different, take on and what one family did to adjust their children to face.
That's a great tip. I might steal that. The other thing that I was going to say too is that I know there's a lot of people who also feel like, oh, I can't breathe, and so there might be a decrease of oxygen coming to my lungs. Again, and, I wish I had an O2 stat and I could wear my mask, which is right here. That's not, people could wear this. Your oxygen levels stay normal. They don't get affected by masks because it's cotton. The oxygen molecules are a lot smaller. They come in, and so it's really not an unsafe practice. I know there's some, because it feels like it's limiting the airflow, that some people have felt like, oh, that means less oxygen is coming my way, but it is not true. You're getting enough oxygen. There's no decrease in oxygen. You could do all the activities that you need to do, walking up and down stairs. And so that is just something that just, again, to remind everybody about.
That's great. So I have a part.
Oh, I love that.
A part cotton and part plastic, and this one allowed someone to see.
Yes, and so, we do have some patients and people who are hearing impaired, and they're just slightly hearing impaired, and so they really are used to looking at our lips to decide what we're using. And so, again, if you have family members that are, and so that way when you're walking outside or going together, you could communicate. So I do love that mask. It is a little bit open on the side, so if the cotton went a little bit further back, it would be a little bit safer, but again, it looks, oh yeah, I see that it's covered, so that's perfect. And so again, just to know who your family members are, and I have seen those online, and it does help our hearing impaired family members to really hear us in a way that use all their tools and their tricks to hear what we're saying with our lips moving as well. So perfect.
Great. I don't have a disposable mask to show you, but a surgical mask, and we do have
I have one here.
Okay, there you go.
There it is. Yep.
So let's talk about those and the pros and cons of those, and then maybe address whether you can. Are these ones that you can wash? I know we're talking about washing.
Yeah. So these are disposable.
Mm-hmm.
So yeah, you probably just only use it for the one day, and you should toss it. And so that's again in the beginning of it, because healthcare facilities, we weren't ready for all the needs of masks. So the supplies that you have in a place that you work is just what you need at that moment, and all of a sudden it changes. And so we didn't have it all. So initially, that is why I really wanted everybody outside of the healthcare community or to really use cotton masks. But now more and more I see these like at Costco. I think you could buy 20 or so and then cost. And so yes, if you could find them, and these are fine. The ones that have a little metal on top, so then it could really go around your nose, is going to be important. And then you could spread it out, and it's the same kind of fit. You want it to be all the way out, so when you make loud, big movements of your mouth, it still stays on. And so yes, these are very safe. And now that they are more common and you can buy them, you can use them one a day and then toss it out at the end of the day.
I know I make big movements, so I'm in communication, so I think that's my job. So how about the, I know you probably
the gators,
but it's a gator. How about this one?
So, again, as we're learning more and more, so a study came out last week a little bit about the gators. And I think because the material, that they're not made out of cotton, they're made out of a different kind of material. And the study, again, that it came out last week shows that they're not as protective as we thought. And so at this point, which is the shift, I'll just be honest, a couple of weeks ago, that's how my son had a gaiter, because it was just easier to convince him to do that. But now the cotton material is probably the safer until we really understand more about what the different materials are. So cotton or the procedural masks for our community is really what would be the safest. On the slide, we also had the fitted N95 masks, and I just wanted to really highlight that the fitted is the key, most important word in that whole statement, because an N95 mask that doesn't fit your face is not as safe as one that does fit your face. So in the healthcare world, every year, or we get fitted for the right masks to make sure that it fits our face correctly, and because that is the most protective. And so if for people that are seeing patients that with COVID, and that's the mask that they should wear, and it's really not recommended for the community as much, because some of them are not as fitted, and they'll have the holes, and so with a large movement, they may not protect you as much as a cotton mask that fits your whole face.
Great. So here's
there it is.
N95. So I don't, honestly, I don't even know how to properly sort of put this on my head. So is it just because I feel like I'm touching the mask? So is
yes.
it just
So there is a trick, and so that is why the fitted N95 really, when we get fitted for them, they teach us how to put it on correctly with what straps we put on first and how we put it on our face. And so, again, and it's really important actually when you take it off to make sure you don't get infected. And so that's why sometimes these really tight fitting masks may not be as safe, because if you get exposed outside and you take off the mask incorrectly, then your hands are dirty, and then you gotta make sure that you wash your hands. And so really making sure that you protect yourself and wear the right equipment is really the right thing. And so if you are going in a place where if someone's exposed and you really do think that you need to wear if fitted N95, you'll be needed to be fitted and taught how to put it on and off.
Great. That is good information. I do have one more question, which I'm going to put on a mask in order to ask, which is demonstrating the face shield. And what is a face shield?
So the face shield, the face shield, which is great, there it is. So it does add protection, and there are some, we're still, it protects you from spreading the disease. And so, for kids under 2, that might be kind of what we recommend. For kids that are really fidgety, you could wear the mask and the face shield. But the face shield alone right now is not quite recommended, because as you can tell, the air will come in around. But again, so the face shield does add protection to someone maybe who doesn't have a great mask, or they only have the gaiter, or they can't really, and you have access to a face shield, that would be good. And it does protect your eyes. But again, really, the cotton masks are really, at this point, for our public and our patients, is what we would recommend mostly. But, so we're still learning, and we'll see what it is. But if you do have a face shield, and it does add another layer of protection to you when you go to the grocery store, or when you need to go and run your errands, or you're going to work.
That is extremely helpful. Are there any masks out there other than the gaiter that really you're seeing around that aren't?
Yeah. So if we go back to the slide, the masks with those one-way valves, and so the one-way valves really just says, if I breathe out, all of my air droplets are going to go straight out, and it really does not protect the people around you. And so those are not recommended either. So if you look at the slide, the top row is recommended in the right setting, and the bottom row is less recommended. The scarves, we're still learning a little bit. It depends on how tightly fitted it is and the material it is. And the gaiter, as I just stated, the study last week really showed a little bit of we're not really sure how protective it is because of the material that it's made, and more studies will be coming out. And so right now I would not recommend it for the time being.
So this is so much information, and so much great information. I can only imagine that folks who are getting all this information from 100 different resources are mentally stressed during this time period. COVID-19 has hit us physically, but there's such a significant mental stress that is put on our community during COVID-19. And so as we kind of talk about what can we do, it even for me raises kind of my blood pressure a little bit, thinking I have two small children under 10, and it creates anxiety and then grief when I find out. I've not had a very close friend pass due to COVID-19, but I have had many friends of friends who have passed, unfortunately, due to COVID-19, mostly older adults, however, not always. And so, what can we do? Because mental and the mental stress of this will impact our physical part and bring down our immune system. How do we stay in the safe, healthy zone in terms of mental health?
Yeah, the one thing, so I do feel that the impact of our mental health is probably the most significant shift in this disease. So the one thing I say to my patients is just, number one, forgive yourself for wherever you are. Sometimes we feel really sad because we can't do, and sometimes we get angry and we get frustrated, and all those emotions are 100% valid. We have shifted in what we do, and how we're social animals at the end of the day. We're social beings, and our social network, even if it's one person to 50 people, has shifted significantly. And so the one thing I say is just be okay wherever you are mentally. The other thing I say is you can't control other people. As parents, we learn that. We think we can control maybe a toddler, but I think I lost control of my child the day he was born, or they both were born. So different people are going to make different decisions. And to be angry or upset, or but you have to make the right decision for yourself. And that might mean to say, okay, well, maybe I can't interact with this person in the same way that I want to, because they're making decisions that I don't feel comfortable with. So not to get angry, not to that person is making the best assessment for themselves and their well-being. And so I think that's the first place I would start, because a lot of patients will come and talk about their kids are doing something. They have older kids that are 20s and 24. And again, I don't have kids that old who are making different decisions, because in our 20s, we all made different decisions, and it was different impact back then, and now it has a different impact. And so, yes, they're making those decisions, and then as a parent or a loved one, then you could make the decision around for you that you feel most comfortable and safest about. Number two is just, what's amazing is how talented and how out of the box thinking we are. And so, whatever way that you could rejuvenate your own self and your own soul, do that. So picking up the phone and calling a friend, we kind of got away from talking to people on the phone. We started so I think all those things, to just remember there's different ways to connect. Technology, some people have access to FaceTime, and you could talk to family members that way. The big popular thing with my kids is the drive-by birthday parties, everyone honking outside. And so celebrate the moments in the way that you feel safest and best. And then if you still feel like in a rut, this is really stressful. People, there's times when people couldn't work or can't work. And there's times that if you're not feeling well, you can't work, and that's a paycheck that you've lost. And so it's a very stressful time. And so reach out to the resources that you have. And the one good thing is that I also learned is people also want to do good if they can, if they have the time. And so there are some resources out there for people to either volunteer in the way and give to help rejuvenate themselves, and also there's resources out there if you actually don't even know what to do next. And I see that we have our mental health website going under there, and so there's different resources, and please reach out. Even though you physically may need to be alone, there are a lot of ways we're connecting, and it's amazing how creative people have gotten in the times, from musicians doing Zoom concerts for their fans to churches being online. Again, so people are getting really creative to connect. And so if you feel stuck and you need some way to connect with people or your provider, please reach out.
And so maybe we can put up the slide to talk about a little bit about San Mateo County and the resources that we have for mental health. You notice the banner has the URL, but these are some of the other ways that you can connect and get the mental health support that you need. Again, this is for folks joining us at the end of this live stream. We are here with the esteemed Dr. Haddad discussing health, being healthy and staying healthy during COVID-19. And so I would love to, as part of this, have folks comment on the live stream, and maybe tell us what is the new things that you're learning, or the hobbies that you're doing, or maybe the favorite new way that you're staying in touch with family and friends. Because as we share as a community, that we could really connect ourselves and learn from one another. I had just suggested how wearing a face mask during time was one way to teach your kids, get them comfortable around face masks. And that might work for some families, maybe not for others. And I think that in the effort, if we share more about what we're doing, we might be able to influence those around us and kind of ease the burden of stress on others. So I am sure that San Mateo County residents have some amazing things to share on how they stay in touch with family and friends. I know that social media has been a big kind of went from a thorn in the side on days, because it's not always a positive mental health escape, to really staying connected with friends and family that you don't see on a daily basis. And so I've seen a shift in how people use social media just from January to today. And so that's one thing I've seen. Dr. Haddad, how do you stay in contact with your family and friends?
So I'm very fortunate. My family is pretty close by, so I pick up the phone on my drive home and I call my mom, my dad, my brother, and so that is how I stay connected. And I'll just share that my neighbor, there's been some difficult days, and so my neighbor saw me walking. I walk every morning. I run. I used to run, and now I'm walking. That's a little bit of just a shift, and she just saw me, and she's like, "How are you doing?" I'm like, "I'm just having a hard time." And so the next day, she knocked on my door with a couple people, and 6 feet apart. We all just sat there and talked as moms, and that was so wonderful, and just it made me just feel so just loved and special. And so I think those little gestures, or just leaving a little note on a friend's door, just saying I'm thinking of you, and connecting that way has been really powerful. And just to pick up the phone or leave a note to someone. So those are the ways that I have been re-inspired and just been really thankful for the community that I have.
You have great neighbors in
I know. Yes, I do. I'm very happy. That's part of the reason we moved there, right? I do.
And so we're going to share the BHRS resource slide once again here. And as we're coming out to a close of this session, I just want to share with you, Dr. Haddad, how valuable this really was for me, but for the community, and how you really enforce that county doctors are here for residents and for patients, and really how you take care of all of us. And in kind of closing, is there anything else that you would like residents to know in terms of COVID-19 and what we should, any expectations or anything that you want to add in terms of closing out this very informative session?
I think that we're still learning. Wear your masks, stay 6 feet apart, reach out to your providers. There's a whole team who care about you, from our front staff to our nurses, everybody who really want to help. And that is why most of us got into this field. And so we're still here to help. If you have fears, express your fears to whoever you feel safest to, and talk it through, and just be okay with not being okay all the time. And so thank you for giving me the opportunity to really speak to the different members. I feel very honored that I get to serve our population. And so thank you for giving me this opportunity as well.
Well, thank you so much for taking time out of your day. And I really am thankful to serve in San Mateo County. The residents are amazing, and every interaction has been just phenomenal. And I think that we've pulled together as a community, and I think frontline workers like yourself are just so essential to everyone staying healthy during COVID-19. I want to invite people to stay in touch. I want folks to know that this video will be saved and shared. So if you have someone that might benefit from this, please do share it. And we will have additional live streams coming up in the near future. So check out the space to learn more. And we will be sharing and building out more resources. So we'd love to hear from you as a resident of what you need and what in order to support you in this journey to stay healthy during COVID-19. So Dr. Haddad, one final thank you. Thank you so much for spending your time. I really appreciate it.
Thank you. Take care.
Thank you so much. And thank you for joining us.